Persistent apical periodontitis after root canal treatment is mainly caused by remaining bacteria in the root canal system, representing 77% of the cases, and this is according to Ricucci and Sequeira's work in 2010. However, the rule of bacteria outside the root canal system, which is extraradicular infection, representing only 6%. Also, non-microbial factors like foreign body reactions or cystic lesions is still debated at that time in 2009. So this article was published by the Journal of Endodontics with the title Histologic Investigation and Root Canal Treated Teeth with Apical Periodontitis, a retrospective study from 24 patients. The aim of the study is to examine treated teeth with apical periodontitis histologically and to relate the findings to the clinical signs to better understand the cause of treatment failure. In their methodology, 24 root canal treated teeth with persistent apical periodontitis, 12 symptomatic cases, and 12 asymptomatic cases using histological analysis, biopsy samples were taken from root tips surrounded with the apical tissue or the periodicular tissue. They were collected during epicoectomy, surgeries, or extractions and proceeded with microscopic examinations. Cases were selected from documented collections with at least 1 year follow-up from symptomatic and 4 years for asymptomatic teeth. Clinical radiographic data were thoroughly reviewed, including symptoms and radiolucencies, quality of the root canal filling, and other diagnostic factors. The tissue specimens were fixed, demineralized, embedded in paraffin, suctioned, and stained with hematoxylin niacin and also bacterial stain. The name of it is Brown and Bren. The histological evaluation focused on detecting and classifying bacteria, location, and the form, and the presence of acute and chronic inflammation. Disagreement between the observers were resolved through discussion, and in their findings, bacteria were found nearly in all the teeth, 11 out of 12 in asymptomatic cases, and 12 cases with symptomatic cases, all cases were found to have bacteria. In asymptomatic cases, bacteria were mostly intraradicular and rarely extended beyond the root canal. Inflammation was mild, and cases showed foreign body reaction with no bacteria. In symptomatic teeth, bacteria were abundant, forming dense biofilm, often extending extraradicularly. These cases showed strong acute polymorphonuclear cells and chronic inflammation. From this study, also, extraradicular infection, which is actinomycosis, and severe inflammatory response were more common in symptomatic cases. In all of the cases, the 5 cases that are diagnosed with acute or actinomycosis were combined with intraradicular infection. So findings from this particular study confirms that bacterial resistance, especially the biofilms, is the key factor in post-treatment apical periodontitis with more severe infection in symptomatic cases. And in conclusion, out of 24 root canal treated teeth with apical periodontitis investigated in this specific study histologically, bacteria were found in all cases. And this strongly confirmed the essential role of intraradicular infection as a primary cause for post-treatment disease. Intraradicular occurrence of bacteria was basically similar in both asymptomatic cases and symptomatic cases, but larger number were evident with symptomatic teeth. Although not very common, extraradicular infection occurs of bacteria was more frequent in symptomatic cases combined with intraradicular infection. Thank you.